Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. In February, our Community Health Improvement Plan team, or CHIP, hosted their annual event for partners throughout Larimer County. This year's event focused on social prescribing and the power it has to address the current CHIP's priorities. In a previous episode, we provided an overview of social prescribing and how it ties to CHIP. If you missed it or would like to re-listen, you can find the link to that episode in the show notes. Today, Jo Buckley, our Community Health Improvement Plan coordinator, is here to dive a bit deeper into the world of social prescribing and the work CHIP has been doing. Jo, thank you so much for joining us.
Yeah, thank you for having me.
To start, can you just remind us what social prescribing is?
Absolutely. Social prescribing is a newer term being used to talk about all the great ways we can support health for individuals and for community through those social connections we have, whether that's a physical connection like playing tennis together or the arts like seeing a theater production together.
Today, we're talking specifically about the connection between social prescribing and community arts. Can you explain what you mean when you say community arts?
So the beauty of community arts and what is so true in so much research about social prescribing is that the arts are all the more powerful for our overall well-being and our health long term if we do them in a community setting or in a social engagement. So that can look like taking knitting from your own house to a knitting club on a Wednesday night, or something like dancing in your living room being a community art instead by doing a broad dance performance in the summertime.
What are some examples of local organizations that participate in community arts?
There are so many. You could probably think about lots of activities that kids engage in, especially this time of year in the summer, theater programs, dance troupes, local choirs of all ages, folks that participate in mural making. I also love to shout out a few organizations we have locally in Larimer County, like Sound Effects Musics that brings musicians into some of our facilities like assisted living and memory cares, as well as local theater that brings lots of different languages and disability access to some of our population in Larimer County.
How do social prescribing and community arts connect and work together?
Well, the great thing about the arts is there is a ton of research on how wonderful it is. Sometimes we take the arts for granted and think it's this above and beyond thing that we can add into our lives, or something that could be saved for a special day if we get around to it. But really, especially with the arts that we are actively participating in, or arts that bring us into community, so that could look like going out for a concert together with friends, or making a watercolor group with friends in the park. All of those are ways that it really builds social cohesion, so how we trust and look out for one another, and our own well-being. So I'd love to share some data around this. There's all sorts of arts broken down, but even if you look across art forms, arts can really specifically lead to health in ways around emotional regulation and enhanced self-efficacy. And they found this across age groups. So older adults in this longitudinal study who did hobbies were 20% less likely to be depressed than those who never did hobbies. Same goes for youth. Those who were participating in a bunch of those high school clubs and activities that had to do with the arts were 28% at higher odds of reporting social support even a year later. So these are the types of engagements that make us human, build on our creativity, help us explore and navigate the world, and make connections that we otherwise wouldn't. So the arts actually are crucial to health, not just an above and beyond thing. And that's why I really like our plan of leaning on social prescribing as counting arts as a crucial part of our health, not something that needs to wait until we feel better.
What would an arts prescription look like from a healthcare provider? What would that process look like for a patient?
Yeah, so this really varies. Other countries like the UK and Australia are a little more prescribed or just a little more advanced in how they see social prescription. And they've integrated it more into their healthcare system. So they usually have link workers that work with folks for around 6 months to promote social prescription for that period of time until it becomes a habit. And that looks like phone calls to check in how it's going, trying different things, seeing what's a fit. and working with individuals to see how they can link into existing community programs. Here in the US, we don't have that widespread healthcare support of it looking the same across the country or even across the county for different individuals. And so, one way that looks here is just getting the conversation started. So, if you're a provider, a great thing you can do is talk with folks, even in the waiting room or when they're in their office visit, about what health and engagement and social connection looks like for them. And know that you have arts in your back pocket as a great thing to recommend and support. When that comes from a provider, it adds validity to it and it adds this sense of care for ourselves that we know this is part of our health plan rather than only seeing it as entertainment. But it should be fun too. So, what we recommend and what some programs do locally, including those out of CSU and other institutions, is trying something that really fits you and your interest. That might be crafting, it might be a metal concert, right? Each person is going to be really different. But I really recommend taking a friend and getting yourself there and having that accountability of a place you need to show up to so that it really is something that you make happen. And then try it out for 6 months. So maybe if you go once a month, you could try the same thing 6 times. It usually takes that long to feel comfortable with it, but that's the way to make the prescription actually stick and be a little more effective than only trying things once or skipping around a ton without finding something that really speaks to you.
So you already spoke briefly about the impacts on mental health. Can you go into a little bit more detail about some of the physical health outcomes that people might see from participation in community arts?
Absolutely. So this is really great to think because, of course, some of the arts are very physical. Like dancing is a great way to use art and physicality in a real paired way that supports health. But there's also lots of ways that support and engage our physical bodies that we don't always think about. So there's a wonderful study of choir and singing and how great that is, especially for folks who may not have the mobility to do other types of cardio. It is great for heart and lung health, and they've actually done studies that specifically for women's heart health, singing can be a really great fit. So there's some that you don't always think about, but this can look really varied depending on the individual, what their physical goals are, or capacities. And so for me, I know that I love making art with my grandma, and she is this wonderful quilter. And when I'm with her, I am up and down and off the floor and going across the room and folding these big quilts. And it becomes something really physical because we're in creation together. So there's not a one size fits all here, but just the stress reduction alone and the social benefits are really going to support overall well being.
So who would you say benefits the most from that kind of intervention?
I would say folks that really can benefit the most from arts and health are those who would otherwise be most socially isolated. That is so many of us in the county, and we really see this along older adults and youth specifically, folks that might not be in the workforce. But really, it depends on the individual, and we see numbers rising for social isolation. Those tend to coincide with other negative health impacts that are related to physical isolation or sedentary lifestyles. And so the great piece about including arts for physical health here is that we're also building social cohesion that lends itself to other ties. For example, if joined a Wednesday night salsa crew and started dancing every Wednesday night, and I was getting those benefits, I'm also meeting people that are different ages, generations from me, live in different parts of town. From my experience there, I know that like there's multiple languages spoken in that space, and I have more of that team and network to rely on. So that's why it can come back to the social isolation piece. The physical activity piece is wonderful, but the arts can really elevate that to this level of social cohesion where we trust each other, we can lean on each other, and we're building a space of inclusivity that shifts the whole lens of our life instead of I have to take care of myself and I'm on my own here to what a beautiful community we live in and there's so much connection to be had.
Are there other kinds of activities that have like a disproportionately larger impact than others?
A lot of the studies do focus in on one type of art to control for what that activity can benefit
Right.
for folks. The thing I will say is that is across the board in the research is that there's a couple common factors that make an art activity a little more beneficial to our health. One of those is co-creation. So wonderful to go see a concert, even better if you yourself pick up an instrument and participate. Another one is culture sharing. So this could be like making art or food, music, or dance from a culture that you relate and identify with and can share with others who share in that culture. And then another is the inclusivity piece, but it's done in community. So all of those pieces are really what's key to art more than the exact activity being done.
So, what barriers would you say exist in implementing community arts prescriptions or referrals in Larimer County?
That is a great point because there are barriers and it's really there's not equal access to the arts and to health and wellness across our county. And that's something we're really working on and aware of here at the health department. So, I would say that transportation can be a really big barrier. To this, there's some options for virtual ways to participate or ways to even localize and support art that you do have access to, inviting people over or working within your own neighborhood. Beyond that, time and resources can affect who gets to go to art. So, for example, not everyone can afford going to a big theater production that's coming through town. However, I would really recommend there's a lot of great free art engagements and folks and organizations that work really hard to create access and invite everyone into art spaces. Another good way to find those is some of those summertime events that happen. So, if there's a festival, a tabling event, or a cultural event that happens through the year, those are great ways to tap into free and accessible art engagement. I would also add even sites like Meetup or Reddit have really good examples of places around you that can get you connected and engaging with arts. It's not to say, though, that it doesn't come with barriers. So if there's something of an access barrier or you're interested in this or you'd like to know more, you're always welcome to reach out to me at the health department. And we'd love to hear you connecting with your provider and looking around what else might be a possible creation because you yourself creating something might open that possibility for others as well. How we like to look at things at the Larimer County Department of Health and Environment is from an upstream and preventative lens whenever possible. So, while I would love to see insurance coverage and I would love to see things like transportation, free tickets, these things that we can do on a local level to look out for one another, ultimately, I think it really comes to policy and how we support the overall structure of the environments and communities that we live in. So, for example, funding the arts and making them free and accessible, both on municipal, state, and federal levels, can really make a difference. And other countries, again, have been leading the way in this effort. Not to say there aren't great examples of how we already do that and can expand it. Addition, it's some of these other pieces that create the structures of our lives, like needing access to a car or having certain types of employment that can sometimes limit us from art and engaging with it in natural ways. So I would love to see a world where we walk to work past a mural, where our coworkers are in our after school crafting league, and we're connecting with each other of these things that really make us human. In the meantime, while we address those barriers, we can really lean on each other for support and invite others to come with us to some of these things, knowing that even though art can most help folks who are most marginalized by isolation, it's really that idea of a high tide lifting all boats, and all of us can benefit and share some of that great peace, connection, and creativity that we build with each other.
So, do you think this is something that could eventually be covered by insurance?
Yes, there is some exciting movement on this. And I mentioned other countries really passing us the torch on this because they've had such success with social prescribing. The first and best example we have is the New Jersey Performing Arts Center has actually collaborated with insurance to get some of their offerings covered. And so this is great and works really well with private insurance and is growing across the country. This isn't quite the case yet for programs like Medicare or Medicaid. So I am hopeful to see it keep growing just because of how much data and research we've seen and its benefits.
How does all of this relate to Larimer County's Community Health Improvement Plan?
Well, our community health improvement plan is really focused in this 5-year cycle on social connection and spaces for social belonging. So we are trying to look at some of those upstream factors of how people get involved, where they have access. And social prescribing has been a key piece this year to make sure that our health providers and our whole healthcare network are bought into the idea of how powerful social connection is, just because it can add that validity to it and make us all take social connection and being with friends or going to see an art performance from something that would be nice to have or something that maybe we've even fallen out of practice with since the COVID pandemic to a key piece of our life that we're interacting with every day or at least weekly.
What work is CHIP currently doing or planning for the future related to social prescribing and community arts?
Well, I'm so excited to share that we have a few upcoming projects. So, for one, we've been working with Community Corrections, which is part of our Department of Corrections under the county government, to work with people in reentry, their access to arts and connection and community. There's been some really profound and inspiring stories from other states that by getting folks access to a concert or a pottery class, whatever it might be, and having them bring a plus one or someone that they may have lost contact with in their life during their incarceration, that integrates them really well back into family and has something that they can share and something that they can offer their support system who's been supporting them and has been able to repair some bonds that are crucial for people getting jobs and housing and some of those other main efforts of reentry. So we're excited that the piece of art has to play in this. And then secondly, we've been collaborating with CSU's music therapy program. They do wonderful stuff across the community and have lots of great work that supports mental health, like kids programs to women's drumming circles. But we've been collaborating with some of their students who write lullabies every semester and our maternal and child health program to connect first-time parents or parents who are going through these challenges in their life to have support of a personalized lullaby written just for them and their baby that they co-create that can really help that bonding in this postnatal period and reduce some postpartum depression. So it's a great way to share art with folks who are really in the thick of it and may not otherwise be able to make time for that, but that can kind of lift the spirits enough to keep engaging with some of the other great work happening.
How are you hoping providers and arts organizations get involved here in Larimer County?
Well, I would love for everyone to sing its praises across town. So, all of us can do a great job first by taking great care of ourselves and maybe even challenging ourselves to try something new this month or see what else is out there. There's always great flyers right at the coffee shop or wherever we might be with inspiration of events and things going on. And I don't know about you all, but we sometimes default to, okay, maybe it would be easier to stay in tonight, but just, like, remembering, like, a workout, like eating healthy, these are all great things that help us expand what's possible, build new routines around taking care of ourselves, and if we're doing that, we're gonna have more options and ideas to share with others in our lives. So I would love for all of our healthcare providers and community arts organizations to just sing the praises of how great arts involvement is and how great social connection and these opportunities for it are for our health. So if you're looking for any more inspiration or want to know more about what's out there, what's possible, and what you can be referring to, I'd love you to reach out to me at the county and we could be great in partnering together of exploring what's going to be right for you and for your clients.
So, Joe, on that note, if there are providers or community organizers that are listening to this podcast who would be interested in getting involved, where would you recommend that they start?
Well, this is great because it can be as formal or informal as you like. If you are already involved with a group of people that go fishing or play cards together, that's a great place to just recommend what you know. Beyond that, there's some great resources like Find Help that offer connection to specific programming. So this is things that are going to be a little bit more health centered, like perinatal moms group that works on breastfeeding support and plays music at the same time. And then in addition, I can't recommend enough just resources that we have like Reddit or like a bulletin board that keep us informed of what's going on because that's going to center us into our local nexus of the community that we're going to have access to. And That can be enough to just plant the idea that art is important and we can all go do it. And then that person might find some specialized care depending on that. So if someone's interested in dance and you as a provider or a community arts organization cheer them on in that and root for it and check in on it, they might be able to find the dance that is just right for them, just because it's one of those things that is so personal, how we relate to art. Please feel free to reach out to me at jbuckley, JBUCKLEY at lermer.org.
Jo, thank you so much for joining us today.
Thanks for having me.
Our next guest on the podcast is Ferrie, the executive director and co-founder of the Dandelion Arts Collective. She's here to talk to us today about the impact community arts has on public health and more about her work with the Dandelion Art Collective. Mimi, thank you so much for joining us.
Thank you so much for having me. I'm really excited to be on the podcast to chat more about arts and public health.
To start, can you tell us a little bit about the Dandelion Arts Collective and the work that you do?
Yes, Dandelion Arts Collective is an arts and health nonprofit. We are dedicated to increasing health equity and public health promotion through performing arts education and practices. So we use things like theater, movement, music, and other performing arts modalities to support health and well-being. We're a 100% mobile program and reach community members across the northern Colorado region in places like schools, social service centers, community spaces, a lot of third community spaces. And we've had the opportunity to work with a variety of partners and populations from eastern or kind of Weld County all the way up to Larimer County.
That's fantastic. Can you tell us how it got started?
Yes. So my co-founder and I are both longtime arts educators and performers, respectively, in different arts modalities, including theater and dance. So after years of performing professionally, we both continue to perform professionally. The wheels started turning about how we could utilize and help collaborate on arts and health interventions. We both really think of ourselves as not only educators and artists, but also activists. And a big component of what we're doing is really trying to consciously think about how arts can intentionally contribute to community level health and shifting cultures of health. So we in 2023 started working together and collaborating on building this collective because we really knew and believed that there were not only other artists that have shared values, but other organizations, institutions, and health practitioners directly wanted to contribute to arts as a health intervention.
How did you guys come up with the name Dandelion Arts Collective?
So Dandelion Arts Collective, when we were really thinking about our name, I loved the idea of it being connected to nature and this idea of growth and thriving. But I think dandelions are often misunderstood. So I was just reading a story about, how dandelions were actually brought to the United States as a food source and a medicinal source, but they've kind of lost that. But for us, throughout history, dandelions have been representative of like hope and resilience, nourishment, growth, healing. But they're also a little misunderstood. And I think that kind of is an opportunity for us to advocate for our contributions as artists and creatives to the world. That's how we came up with the name Dandelion Arts Collective.
That's fascinating.
We just think they're beautiful. One of our goals is to plant those little seeds and let them scatter and see how new things grow. We hope that all of our, programs and partnerships just help pollinate and create that little opportunity for a new positive health outcome.
How many people do you serve through the Dandelion Arts Collective?
So this last year in 2025, we served over 3,600 participants and had over 9,100, almost 10,000 participant engagements.
Wow.
And yes, we're really proud and excited to have the level of impact that we've had in such a short amount of time. And I think that's really a testament to the breadth and depth of what we try to offer, who we like to partner with, and also just our amazing team. So we have about 30 team members and collaborators in our collective. Myself and my co-founder, Krista Jill McBrown, are leading the artistic endeavors. And we have a wonderful team of board members and artists and scientists and interdisciplinary artists and educators that collaborate with us.
Dandelion Arts offers a number of programs that address different community needs, and I was hoping we could just kind of talk through the different ones and how they each support health and well-being for participants.
Absolutely. So I'll just talk briefly about each one of the programs. So our first program is called Seedling. And this program is really specifically working with families and children in early childhood. We work a lot in arts based movement, like creative movement. We're working in public school systems, libraries. In addition to the direct health benefits of just participating in art and how it contributes to, health and development, both cognitively and emotionally, we're really thinking about how we can engage children intentionally in civic practices and have them contributing their ideas to larger public health goals by really centering their voices. So, our second program is called Bloom. Bloom is a program that is directly working to help support youth mental health through arts intervention and creative practices. So, something that might be interesting to listeners is if you are familiar with like arts based therapy, this public health and arts and what we're doing is a little bit different. So, clear distinction is say you're receiving an arts based intervention through like a psychiatry intervention where it's one on one, or maybe someone in a hospital setting is receiving an arts intervention. We're consciously thinking more about it as a community level intervention. So, for example, with our Bloom program, we're really consciously trying to bring young people and teens together to create community and use the arts practices to support self efficacy, empowerment, and really contribute to the interventions that really support lifelong mental health. One thing that many of us know is most mental health challenges are really not addressed until a decade after they're really experienced. So for us, primary prevention is a really big key component of why we're doing this work. Our nurture program addresses holistic and joy and pleasure based sexual health education. So sexual health is something that we experience through our lifespan, and we really try to create programs, meaningful programs that go through the lifespan. So one of the programs that I offer and have developed is called Positive Play. I'm really excited. That'll be presented at the Work of Fred Rogers conference this summer and is a program for children and families to really build their strength and tools in autonomy and consent through play. And our director of the Nurture program, my co-founder, Crystal Jelinek Brown, her program, Make It True Theater, also uses a lot of devised theater work and creative practices to support sexual health education. She's doing amazing work on not only working with teens and youth, but also really creating sexual health programs for caregivers to also, be able to engage with their young people in meaningful and healthy ways about sex and sexuality from a place that isn't based in shame, but really rooted in, concrete information that is also centered in joy. Our Propagate program specifically works with disabled populations, so people with neurological and physical disabilities. We have programs where we create devised theater projects with young people and adults through ongoing programs and relationships, visit day programs for folks with disabilities, and also work in school systems. And I think beyond, again, just the direct health benefits of arts participation, I think for this population, we're really striving to center the voices and passions of people with neurological diversity and disabilities, and really not thinking from a medical model, but a person first model, and creating opportunities for people to express themselves in meaningful ways and really share their stories about things that are meaningful to them, not in the, bubble or just the viewpoint of them like only being disabled, because we are a multitude of things. And finally, our Roots program is specifically dedicated to helping people build environmental stewardship through the arts. So we have a lot of partnerships with environmental organizations and offer a lot of programming at these intersections of how we build relationship, a meaningful relationship to nature, and sharing public health information about climate action or building our skills as naturalists. So this happens in partnership with a couple science organizations, including the Watershed Center and the City of Longmont Water Conservation Department, where we create a big festival for people to learn about their watershed through arts and science engagement.
Wow, that's a ton of really varied and interesting programs.
Yeah.
I am very curious to know what kind of impacts do you see these programs have on their participants?
It's really a breadth and depth of impacts that we see. We're really seeing a lot of like increased literacy of all kinds. So with young people, we're seeing increased literacy in empathy skills and emotional literacy. We're really seeing a lot of opportunities for people to build social capital and build really meaningful relationships through arts experiences. Sometimes that's really practical stuff like building physical literacy, and building more interoception skills so people have a deeper connection to their bodies and the sensations of their bodies. I also think we've really seen a lot of people grow in self efficacy and really feel empowered to call themselves artists or practitioners or activists through our programs. I really think that I've seen a lot of people experience joy and wonder and awe and pride. And, just my favorite moments are just seeing people really meaningfully connect with people they care about, whether that's someone new that they've just met in their community, or a family member or a caregiver, a teacher, a fellow teacher, a peer. Those moments of connection to me I think are one of the great joys of arts interventions because, as many of us have seen in kind of the work of public health research, isolation is becoming a really, really difficult challenge in the public health field. And I think that arts is one of the best strategies and solutions to helping decrease isolation.
Definitely agree. And yeah, we've seen that time and again here just in working in public health, how bad isolation can impact somebody's health. Would you mind talking a little bit about some of the health outcomes that you see?
Yes, absolutely. So I just wanted to remind myself. So it was 80 years ago that the United Nations declared access to arts as a human right.
Oh, wow.
And I think that that declaration is really a testament to, so a lot of people that do public health research kind of talk about it as duh research. They're like, well, yes, arts is good for us. And I think there's a couple things that we can really look to now, though, that there's people doing really big, large cohort studies and collecting longitudinal data. So we just talked a little bit about like isolation and social health, which is just a huge component. Getting people gathering together and breaking kind of invisible boundaries and constructs about what it means to be in community, I think has a huge impact. There's a lot of research about the interaction between arts and mental health. So there was just this huge study that came out in Australia about supporting adults with depression, and dance blew everything out of the water, more than SSRIs, more than any other kind of exercise, more than cognitive behavior therapy, which isn't to say that as arts and health practitioners, we think that everybody should only be doing art. We think that there's a lot of different kinds of interventions that are really important, and going to your physician to make those connections about the medications that you might need or interventions you might need is great. But we love that they're proving that arts can be one of these things that is most impactful. There's a lot of research about PTSD, especially for veterans being supported by arts interventions, group singing for postpartum mothers that have just given birth, really being supported in postpartum depression through group singing activities. In terms of physical health, we can think to things like Parkinson's. So there's a lot of research about movement practices and supporting people living with Parkinson's. There was just a big study that came out that, regular arts engagement is really equivalent to like 1 hour of exercise every week. So you don't have to physically be moving, but of course, when we sing, we increase our lung capacity. When we dance, we build balance and coordination. There's also a lot of research about the cognitive benefits and really using arts very intentionally through the creative aging, but really through your lifespan. So it's not only building, like gray matter and white matter, but we're really thinking about it in terms of supporting people with dementia and Alzheimer's. and using it as a preventative tool. In clinical settings, it can be really effective for pain tolerance and pain management. There's so much research about it supporting early childhood development. Like the list goes on and on. So I think at the end of the day, it's really about people finding arts interventions that feel meaningful to them. It doesn't have to look like a class, but you are going to reap the benefits of participating in arts engagement no matter what you choose.
That's fascinating.
There's people that start a singing class and they're interviewed later and they literally say, "This program saves my life." I don't want to diminish or underestimate the fact that I think that arts interventions can be life changing people and can set people on a trajectory for lifelong thriving and health.
Dandelion Arts Collective offers programming that touches so many different needs in the community. And I'm just curious how, as an organization, you landed on those priorities.
We started with really looking large at the Healthy People 2030 goals. And then we really honed in on doing a local needs assessment. So we looked at county level public health goals for the next decade. We did lots of interviews with organizations that we partner with, are regularly engaging with participants that we're hoping to obviously partner with and find programs and create programs for. So we have a community council that really makes up a large portion of the population that we're aiming to serve. And I think that's something that is a little bit unique about what we do is we build a lot of new programming. So using our essentially years of expertise, and we have such an amazing team of educators and practitioners and cultural stewards, we've really had the opportunity to build original programs for specific populations based on their communicated needs. And I think that that is something that maybe is a little bit distinct from maybe just like educational entertainment or going to a concert, for example, is like amazing arts intervention. And something that we're strategically trying to do is create these atmospheres of connection that you can experience from going to a symphony or going to see a show or engaging in, like a community art class, but really weaving in the public health goals that have been articulated by the population and integrating those in as seamlessly as possible. So what feels just like play and creativity and a creative process also can dive into different public health data information, public health communication, civic engagement, and really kind of some of those underlying public health goals that organizations and partners might have.
Our CHIP team has been focusing on social prescribing recently, on raising awareness about it and supporting social prescribing in Larimer County. Are you familiar at all with social prescribing?
Yes. So I first learned about social prescribing through my arts and public health certification with the University of Florida. University of Florida School of Arts and Medicine is one of the institutions really leading research in the United States and is really a big proponent of social prescribing. The arts on prescription that's happening in the United Kingdom. There's social RX that's happening in the United States. It's formerly called Arts Pharmacy. They're not working in Colorado yet, but they are working on a national scale. Actually, there's a program that I just learned about in Steamboat called Wild Horse, where they're working with young people and using social prescribing to work specifically with teens to support mental health. So kind of a smaller, more, rural mountain community. So I know it's happening. And I will say for us as Dandelion Arts Collective, it's happening a little more guerrilla style. We've had a lot of healthcare providers and social service organizations refer participants over and patients over to us to, participate in our programs. And we'll hear from them, "Oh, we heard about you all from, this mental health organization and thought it would be a good opportunity for us to engage." When I offered a positive play program once at a public library, there was a family that contacted us that had been referred a foster care family, and they thought that that would be a great intervention for them to support some family bonding. We're really excited when those kind of things happen. I would say it's also reciprocal. So one of the great things about being an arts and public health organization is we can also refer people to other healthcare resources that would be valuable based on the conversations. So much about what we're doing is really building relationship And I know like the word community gets used so frequently and so broadly, but I really do think that, community building at its heart is about, sharing information, resources. And just the other day, I was able to, we were working with a group at a children's museum in Lafayette. And this was specifically an event for children with neurodiversity and disabilities. And I was able to refer them to a practitioner that specializes in a somatic therapeutic service called Feldenkrais. Like those are the kind of things that we're weaving in, or, partnering with an organization like Longmont Food Rescue. All of those interconnections, I think, really speak to why public health and arts, I think, are a natural intersection because they both recognize that health is very holistic.
How would you like to see social prescribing integrated into community arts work here in Northern Colorado?
This is a great question. I have a lot of goals. So I would love to see arts engagement be a regular question that people receive at a routine doctor's visit. The same way that, we ask about sleep or nutrition or safety, I think it would be wonderful if healthcare workers were just integrating and building arts as one of the pillars of health that people can consciously think about engaging in as part of their health literacy. I am really passionate about, and we're really passionate about primary prevention models. There's a lot of opportunities to build research and just programming that supports early intervention and primary prevention, utilizing the arts. So it not only serves as like secondary or tertiary care for people that are already experiencing health ailments, but also for people that are really trying to build. And this is one of the things that's really exciting to me when we're talking about kind of the evolution of public health. So, we've been working a lot in the realms and domains of like the social determinants of health. We're really thinking about building cultures of health. And those sociocultural changes, I think, really start with social prescribing and arts interventions just being woven into everyday experiences in everyday societies. So seeing them in community centers, seeing them regularly in school, seeing them in community spaces. So whenever I see a community arts festival, my brain is going, public public health in action. Like that's really exciting to me. Another thing that I'm really excited about is continuing trainings for prospective arts facilitators and educators so they can really learn about what it means to be an arts and health practitioner. So we've been really lucky to engage in professional development that has helped us really shift kind of that model of being not just an arts educator, but also being a health practitioner. And I also think simultaneously, not every arts experience is necessarily going to be healthy for people, especially, it's not like a catch-all. Like people have had negative experiences in the arts. And it's not to say that every arts experience is going to be healthy for every person. So I do think it takes some conscious training and opportunities for artists that are interested in this field to really receive professional development and continuing education so they can really be consciously thinking about trauma-informed care and healing-centered practices, being able to develop what are the interventions that are going to be most supportive to a person or a community. And that, of course, takes relationship building, but also, and just learning through experience. But I'm excited to see where that and how that, our field essentially is going to build over the next decade.
What do you wish more people knew about the connection between health and the arts?
I think sometimes when we think arts, we might think of going to a museum or going to a show or taking a dance class, singing in a choir, but arts can be a lot of things. So it could be creating your garden, being gardening in your backyard. It could be cooking a new recipe. It could literally just be doodling in a notebook while you're having a conversation. There are so many different types of art. So really, I think focusing on anything that ignites your imagination, curiosity, feels inspiring, creates awe for you. And arts interventions don't necessarily just have to be something that you do, but also something that you experience. So there are direct health benefits of just going to experience art. So if you haven't taken on this identity as an artist And while I believe everybody is a creative and an artist because, you know, we're part of nature and nature is creative, that, there's a lot of ways to engage in it that feel right for you. So if going to do karaoke is not your jam, that doesn't need to be your, arts practice. It really can be anything that feels right to you. Researcher Tasha Golden, an artist, she really talks a lot about the benefits beyond direct participation. So there are a slew of benefits of just direct participation. But I also think that, there's a lot of opportunity, and she speaks to this a lot about public health communication and onboarding. So, like helping people understand and get more information about public health through arts interventions. Sometimes that might look like a mural, sometimes that might be communicating education about epidemiology, using the arts very intentionally to be that bridge for communication. Arts really are great at also exploring stigmatized topics. So sometimes it could be hard to go into a setting where you're like, all right, let's talk about your trauma. But with arts, you can engage in a way that offers an entry point and a way to explore it on a somatic level, maybe through an experience of drawing or free writing that kind of removes that barrier of feeling like it is therapeutic, which it will be, but kind of takes away that kind of stigmatization. Tasha Golden also speaks a lot about this, and this is something we're really consciously trying to do, is create more comprehensive qualitative data for public health research using arts. So an example I want to give is we partnered with the city of Longmont on some environmental workshops. And while adults were doing a particular program, I've worked with several groups of children, and we created pieces of artwork that were reflective about like the environmental goal that was being discussed at that meeting. That art piece became like an artifact that we were able to share their goals for environmental change in the community through the actual art making process. So I think there's a lot of opportunity to get more in-depth and nuanced public health data through art practices. Tasha Golden worked in a women's prison system for incarcerated young women, mostly in teens, that have experienced, oh my gosh, a depth of, well, just a variety of life experiences. And she worked with them in a creative writing project. And compared to the 5-point like art survey, she, through this creative writing project, was able to give the team of collaborators and researchers that she was working with like way more information about these people's life experiences, what would have changed, what they needed through this creative writing project that never would have been answered by just like filling out a survey. So I think there's a lot of opportunity there. I think there's a lot of opportunity for arts to also help people engage in civic dialogue. So when we're thinking about big cultural changes and, shifts in social justice, we can think about songs that we've maybe seen or someone holding up a protest sign. So I think really arts can meaningfully help propel sociocultural changes, because if artists are good at doing one thing, we're really good at imagining futures that don't exist yet. And I think that's naturally part of what public health does too. It's like we're thinking really long term. And I think as artists, being in that creative space of imagining something else, imagining a different world, and building that through a creative process is all part of, how we make those bigger cultural changes that will increase health equity.
For our listeners who want to get more involved in the Dandelion Arts Collective or learn more or join one of your programs, how can they go about doing that?
They can visit our website, dandelionartscollective.org. You can also email us at info@dandelionartscollective.org. And if you're out and about in the community, you probably might find us. So if you're in Larimer County, you can find us this summer and fall at the Fort Collins Museum of Discovery. You can find us at public libraries throughout the community. And yeah, we encourage you to check out our events page and see what's coming up. If you're an organization, whether it be a public health entity or a social service organization, we love working and finding new partnerships. And one thing I didn't mention is, we partner with over 35 community organizations. So we really believe that art is a communal act. I think one thing that we can really do is look to people that have already been doing this for generations. So that really includes indigenous populations, artists, educators, matriarchal communities, intergenerational communities. They're naturally and consciously weaving in arts practices, cultural practices into their everyday lives. And I think that for all of us, we can look to and be in community with people that are centering arts in their lives and really see an opportunity to really learn from communities that are doing this really effectively. We're really excited and passionate about collaborating with other community members and organizations that have shared values. We love seeing everybody out in the world creating and engaging in art. And we're so, so grateful to contribute in our small way.
Mimi Ferrie Lee, Executive Director and co-founder of the Dandelion Arts Collective. Thank you so much for joining us.
Thank you.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.